This
Initiative.
conference will now be recorded.
Good morning, everyone. This webinar is a project of Human Services Council Disaster Readiness and Resiliency Initiative, funded in part by the New York City Department of Health and Mental Hygiene, and to ensure both that organizations can help those who need them after disaster, and so that they can continue to fulfill their normal functions, HSC helps organizations prepare for emergencies. So welcome. My name is Haim Abadia. I'm the presenter for this webinar. Jason Wu and Jennifer Diamond are managing the technology and logistics. If you have questions at any time, you're welcome to type them into the chat frame, and I will make every effort to respond to those as we go along. One of the challenges we've had in converting this training from an in-person group experience to a series of webinars is that this format is not as conducive to asking questions. So do write in questions in the chat frame at any time. But in addition, you can address questions to info@humanservicescouncil.org. Emailing info@humanservicescouncil.org, and if you put training in the subject line, that'll be a help. And we will review those and regularly, and over the next this week, we'll respond to those, and in the next self-study webinar, the pre-recorded webinar that you'll get information on, you'll see we'll try to answer those questions as well. So today we'll be talking about one of the sections of the Human Services Council's Emergency Readiness Action and Response Plan template. This is a template for organizations to use in creating their emergency plan. You received links to download it, and it'll be helpful if you have it with you, either on a screen or printed out. And you see in the chat box that Jason Wu has provided the link, the direct link for the template. So this is one part of a multi-part training. First, there was a self-study webinar that provided an introduction, and then the group webinar held live on April 7th. That webinar provided an overview of emergency preparedness, and especially of writing an emergency plan, including the process of setting up a team and the steps to go through in completing a plan. The second self-study webinar focused on two topics: a general introduction to the role of human services organizations in disaster, and the emergency action plan as part of your overall emergency plan. That part of the plan describes what you would do in cases of emergencies like fire, gas leak, bomb threat, et cetera, And the third self-study webinar discussed incident leadership, how your response and recovery from a disaster would be managed, and went into detail about mission essential functions and why mission essential functions are a critical concept in a continuity of operations plan. Now, in this webinar today, we'll focus exclusively on that part of the emergency plan, the continuity of operations plan, sometimes called a COOP, C-O-O-P. And if you did not watch some of those webinars, or if you missed the first live webinar, you can go to these URLs and you can view them afterwards. This webinar also is being recorded, So in the next couple of weeks, you'll get information on where to find this webinar as well as the links to those others. You'll also receive info on how to access the final self-study webinar. And that'll be an opportunity for me to answer any questions that may have come in to info@humanservicescouncil.org. And it'll cover details on how to ensure that your emergency plan remains a living, relevant document. It's of no use if it is put on a shelf and never looked at again. And finally, that webinar will suggest what you need to do to get to a final goal of actually having a written emergency plan. So today's session is very much oriented towards making progress towards a written emergency plan. So one thing we want to do is review what should be in it, and you should also use this as an opportunity to think about what your own organization's emergency plan might look like. And we'll spend a good amount of time working with the HSC emergency plan template to see how you can use it to create a written emergency plan. In an earlier webinar, we gave you a list of things that would help you make sure that your organization is prepared. And the top thing on that list was to write an emergency plan. Studies have shown that having a written plan improves an organization's ability to recover from disaster. So I want to emphasize that the plan must be for your organization. It's not generic. The plan is not meaningful unless it reflects the reality of your organization. So even if you have the resources to bring in a consultant or someone to help you, that person can never just write it for you because no one knows your organization like you do. The best people to write your plan are you and other staff of the organization. We suggested this 5-step process to get you from start to finish. And the product, the written emergency plan, would be likely to include these sections. And these are the sections that are in the template. The emergency plan template was designed by Human Services Council specifically for human services organizations. I know that one of the issues organizations have encountered is they go online, they find continuity plans that are designed for for-profit businesses and find them difficult to apply to their own organization. The template we have is largely designed for mid-sized organizations, but it's also helpful for smaller and larger organizations as well. And so today we're going to focus on the continuity of operations plan. It's called a COOP, and you now know that if someone says a COOP plan, that they're being redundant. Continuity of operations plan isn't really necessary, it's just a COOP. And simply put, the COOP is targeted very specifically on what happens when your operation has been shut down in whole or in part. And you want to get back up and running as soon as possible. So we define an interruption of operations as any time you can't do what you do. And that could be for a long time or a short time. It could be for your entire organization or just a part of it or different parts of it. Anytime that happens, it's an interruption of operations. And a COOP explains how after that interruption of operations, the organization will start again to deliver services. If you have with you the HSC template for the Emergency Readiness Action and Response Plan, you can turn to the table of contents. And as you see, the COOP portion of the template has a description of the purpose of the COOP, how it applies to the organization, and its scope. It also identifies the organization's mission essential and primary business function. I hope you've watched the self-study webinar that explains how to determine mission essential functions and why that's important. If you haven't, you should go back after this webinar to look at that one, because coming back to the mission essential functions and primary business functions is really what the core of the continuity of operations is about. And it's going to cover 3 sections as you see here: activation, alternate operations, and resumption. And the COOP itself begins on page 17 of the template, although you might have gotten a draft with the page numbers ran out. It will be there. You'll see it's section 5. And despite what we call them in the table of contents, don't make the mistake of thinking these parts of the COOP are sequential stages. They're not. Activation does usually come first, but whether the alternate site operation comes into play will depend on the kind of disaster that happens and the organization's individual circumstances. Resumption of functions may begin before activation is actually over. All of them are important, and all of them need to be in a plan. And I'll remind you that at any time you can put questions into the chat box. The activation section begins on page 18 of the template, describes how it is decided to start a continuity of operation, how that's communicated, how the COOP is managed, and what changes might be necessary in the service delivery. So let's look at those each more closely. Your plan should say enough about making the decision to implement the COOP that it's of guidance if and when it becomes necessary, but without being overly rigid. Some questions you might ask yourself when you put it in writing include: who would decide when and how to implement it? What factors might go into that decision? You'll want to give some guidance also on communicating about the COOP being activated. How would staff be notified? At what point would clients be notified? And of course, these are just examples of questions you should be thinking about as you write these sections. They're not definitive. You want to give some thought to how the COOP will actually be managed. So, who authorized the plan for leadership? How will that structure be communicated to staff? And you need to consider the possibility that your clients and possibly other stakeholders will have new expectations of you. This is especially important because we know that disproportionately vulnerable or marginalized communities both are disproportionately impacted by disaster and do not receive equitable resources after disaster. So how will those needs be assessed? And who will be involved in determining what changes in service delivery are necessary? What those should be? And as you think about all of these questions, think about how you will engage appropriate stakeholders at all levels. What levels of staff, what units of staff within the organization. All of that will be important in your planning. So when it comes to alternate site operations, beginning on page 19 of the template, if a disaster disrupted the use of your facility, your location, you may need to think about whether it's possible for you to operate in another location. So how would that decision be made? If you can't do what you do where you normally do it, can you do it somewhere else? And those kinds of strategies should be considered now in planning rather than waiting until something happens. So where might that be? How would you make those decisions? If you think you can operate elsewhere, do you have that lined up? Do you know now where that would be? Consider that you might need more than one site. For example, if you have an after-school program that provides homework help and recreation, you may be able to do homework help at a local library, for instance. But you can't do basketball there. So you have to think about the possibility of a different site for that part of the program. All of these considerations you should be thinking about now, and where you can make plans to move forward with that. So you may want to have a conversation now with your local library, if you're doing that after-school program, to consider whether they actually would be available to you, and do you want to make some arrangements? Not to mention that it's helpful to do in case other people also would like to use that site. And in some cases, you might need to consider making sure that the alternate site will really meet your needs. You want to consider, of course, how communication will be done, how staff will be informed, that operations will be located, and also, of course, how you make sure you get feedback from staff so that you know how that can best be accommodated. And would it be across the board or phased in? Would everything move to that location, or would parts of your operation move to that location? Would your operation move there in sections, etc.? All of those things should be considered. And of course, how will clients find out about it? This is something that you would, of course, brings up the issue that you need to consult with clients in selecting a site. One organization I worked with had an alternate site, and when it came down to it, they discovered that their clients were not willing to go to that site. Whether it was too far from their homes or whatever, the point was that once they talked to clients, they realized they needed a different site than the one that they had selected. So if you were in a different site, especially if you're in more than one site, then you need to consider how that impacts your leadership structure. Does it get managed separately, that site? Do you have the same facilities people managing both sites? Do you have programs operating at one site with a different leadership than that program would be at your current site? and basically who's responsible, who are the staff who are going to be in charge, given that it's a different site. We now come to really the core of the continuity of operations plan. And this is resuming the individual functions, the mission essential functions and primary business functions. In the template that starts at the bottom of page 19. And this is where you'll put down in writing how you plan to resume your organization's mission essential functions and primary business functions. As you see, you'll include a description, you'll provide the strategies for resuming the function, you'll address staffing, include a time frame, and talk about the external stakeholders that are relevant to each one. So first, a description of the function. Why is it important? Whom does it affect? Those need to go into your plan so that it's clear this resumption, how it applies and who it applies to. And the centerpiece, of course, is explaining how you actually will resume essential function. The focus here is on reality. The focus here is on considering pragmatically what's feasible, but also thinking creatively. You're not going to plan every detail because you can't possibly know exactly what the situation will be after a disaster. But you'll think about what the most important considerations are. What are general approaches that will work after a variety of impacts? And we'll look a little later at an example of what that might look like for an organization. Keeping in mind that this will be an unusual situation that you're dealing with, you need to be conscious of how the extent to which it differs from business as usual and to the extent to which it should be approached with precedence, with your usual way of dealing with things. You need to think, of course, about the staff, particularly who will take a lead in resuming this function and who will provide support. Remember, always plan on an alternate. So anytime you indicate in your emergency plan that a particular staff person is responsible for any particular item, make sure there's an alternate named also. You'll need to have a concept of priorities. You'll need to have an understanding of how the organization is going to approach functions from in terms of the priority of its mission. And that will involve giving an estimate of how long it might take you to get any given function operating again. Now, in considering that time frame, you need also to consider contractual or legal mandates. And of course, the impacts on clients. Consider other stakeholders as well. All of it plays into the bottom line concept of prioritization. Because again, you're dealing with an emergency, you're dealing with a disaster, you're not dealing with business as usual. And that may involve making some hard choices. some people will be very upset or concerned that the function they manage is not being prioritized. So you need to think ahead about that and how to deal with that. It's important that everyone understand there's a transparent process here that is intended to address the organization's priorities in terms of its mission. There are also people outside the organization that are impacted by any decision you make. So think about both those on whom you rely and those who rely on you. All of those external stakeholders, and how you deal with those external stakeholders will be a function of your approach in general to the issue. How do you normally incorporate the feedback of external stakeholders? How do you normally reach out to external stakeholders? And there may be a few things that don't quite neatly fit into the mission essential function resumption model, and so the template takes that into consideration. For example, HR may need to do some things based on department rather than the function that a person is working on. HR might have input also into changes that are made in the nature of the work that people are asked to do. Sometimes there may be specific time requirements related to a program. So for example, an organization may be doing something, have a program that's funded and also regulated legally, so that if they must provide reports to a regulatory agency every month, that needs to be considered in developing the time frame. And it's possible in some situations that any given external stakeholder who relates to one program rather than another. So when there are distinctions between programs, whether it's in the time frame or the staffing, you need to think through how that will be explained. So we're going to take a look at resuming individual functions by taking an example. Gotham Care, Inc. is writing an emergency plan. They've identified their mission essential functions. One of those essential mission functions is home visits. And first they're going to describe that function. Note that they start with why it's important. Home visits are essential to effective case management. And there's a second reason, and that's also important. But notice that the reason that's provided first is why it's important in terms of the mission. They also include all the programs that conduct this function. They're not trying to define what a home visit is. We assume that everyone involved knows what it means to do a home visit. What they're describing is the function in the context of the organization's continuity of operations plan. So all of these programs use this function, and I'll draw your attention back to the previous webinar when we spoke about mission essential functions and explained that how one function can apply to a number of programs, and one program may have a number of functions. So now that it's described what this function is, Gotham has to think about how it will start doing home visits again if anything has prevented them from happening. So first they determine what the critical components are. To do home visits, the staff need transportation, and they need to document their case notes. Right? These are the two things that have to happen in order to do a home visit. So they start with the transportation, and even before they get into the strategies for how staff will get to home visits, they're explaining what staff will not do. Staff are not permitted to travel into areas which have been put off limits by official personnel. This is important because anytime you think there's a chance of a hazard situation, make it clear that safety comes first. That's important for many of reasons, not the least of which is that it assures staff that your concern is their safety. And you're not going to be asking them to do things that aren't safe. So Gotham has come up with a few things they might do if faced with a transportation problem. And notice there's more than one contingency. Never think that there's only one way to do it right. And some of these solutions may or may not make sense for a different organization. Every organization needs a plan that is practical for that organization. Another thing is this guaranteed to work? Is this guaranteed to make sure that staff are actually able to get to home visits? There are no guarantees. What it does do, however, is gives Gotham an advantage. Writing a plan has taken Gotham through a structured thought process that gives them a definite head start when a disaster happens. And having the plan in writing ensures that the organization keeps that head start even if there are staff changes. So one of the things to keep in mind is it may be true that many of the things in your plan are things that you would do anyway after a disaster, that you would have thought of these ways to cope with the transportation interruption. But having them already thought out is a tremendous advantage. So then, in addition to transportation, we said that caseworkers, case managers need to be able to do case notes. And again here, there's more than one contingency. They've considered what might happen to get in the way of staff doing those case notes. So they come up with a couple of contingencies. One is a spreadsheet that's on everybody's laptop, so all the staff have a laptop, and it'll be not difficult to load up on those laptops now, not after the disaster, but now load those laptops with a spreadsheet that can be used to track case notes. Again, the idea is that it would be a temporary thing. It would be done just while there's this problem, this challenge in doing case notes. And obviously, Gotham does not want to use paper. They really don't. But that is included as a possibility. A stopgap, certainly not preferred, but if it has to be done, it has to be done. And importantly, they thought through how to make that doable. So they're not going to wait until the disaster happens to start photocopying forms and then having to get those somehow to staff. What they're doing is they have some forms, they're providing them now to staff as part of the emergency preparedness. Always remember to communicate and to think through how communication will be done. In this case, they're hoping to use telephone contact. If there is no telephone service, they may simply be left with the possibility that caseworkers will show up at the home for either for a regularly scheduled visit or not, and fill the client in on what's going on and how the services will be approached. Other organizations may have alternative systems. Every client may know that there's a phone number they can call into that'll have a recording to tell them what will be done in an emergency. And then there's also this statement in their strategies, which perhaps should go into the time frame section, but it's included here for transparency, so that when people in the organization look at their strategies for resuming home visits, they would understand why certain decisions are being made the way they are. Having developed their strategies, Gotham goes on to the staffing section. And first, they identify who is leading the resumption of this mission essential function and who is the alternate. Again, I'll emphasize that you should always name an alternate. And actually, I would have an improvement here, because Selena Kyle and Ethan Bennett should also be given job titles. That may be necessary if there have been staff changes that haven't been incorporated into the plan when the disaster happens. Having an alternate is essential because you can be fairly sure that if a disaster happens, somebody important is probably on vacation and cannot be reached. And for that reason, many organizations who have a large staff in their emergency plan will include not just one, but two alternates for every important position. And it also specifies the other staff that would be involved. Gotham recognizes that an emergency may also impact staff directly, right? So it may be that your clients are impacted, but also your staff. And of course, during COVID-19, organizations are seeing that all of their staff is impacted, although in most disasters, such as hurricanes or floods that are more geographic, it's likely that some staff, but not others, will be affected. And note here again that they have brought in HR to make sure that program staff and HR staff are collaborating and reaching a plan that will be appropriate. So now that they have that plan, Gotham is prepared to implement a continuity of operations when they need to. I have not seen in the chat any questions, but feel free to put them in at this time. Or, as I said earlier, you can email them to Human Services Council, and we'll do our best to address them. In other sessions, we talked about readiness, emergency action, and incident leadership. Today, we talked about continuity of operation. There'll be one more self-study webinar, and among other things, it'll address how to maintain your plan once it's been written. There are too many stories of a chief executive officer after a disaster who realizes that, I've been seeing that emergency plan sitting on the shelf all these years, and pulls it out, and to their dismay discovers that it's absolutely irrelevant, that it was written some time ago. It has not been kept updated. It has not kept pace with the organization's changes, and it is as useful, one told me, as a doorstop. So that is essential, and we'll discuss some of the best ways to approach that, best practices in the field. And we'll also go into next steps. If you are ready now to begin writing your plan, we'd like to help you do that. And even if you're not quite ready to begin now, we think it would be good for you to have an awareness of what those next steps would be. If you decide that you're going to write a plan, what actually would you need to go through? What's the process to ensure that you get to a final goal? Because that really, is what we're looking for. We're looking for you to have an actual written emergency plan, and we want to make that as feasible for you and as pragmatic as possible. So again, any questions you have can be sent to info@humanservicescouncil.org. If you put training somewhere in the subject line, it'll get to the right people more quickly. We'll look forward to answering those. And when you get the information on the final webinar, you'll also receive an evaluation form to fill out. You'll help us a great deal if you provide frank answers. As you know, this series of webinars was originally designed as two in-person half-day sessions. And it had to be completely redesigned. So we very much want to hear from you how this has gone so that we can make some determinations of what worked and what didn't. Thanks again for joining Human Services Council's training, Emergency Planning for Human Services Providers. I'm Haim Abaja. Thank you to Jason Wu and Jennifer Diamond. And thanks to you for joining us.